Steve, we have talked about the basic seminar, the introductory seminar, and this is a great seminar. We've done it 8 times so far. You've taught eight times so far, and I love it. The students love it, but there is the advanced seminar, and I'd like to talk with you about the advanced seminar. If you had to describe this seminar in one sentence, what is it about, and what is the outcome for the students?
The introductory seminar is primarily about how your ideas impact the health and healing of your patients or clients. The advanced seminar is the flip side of that coin, namely, how do the patient's ideas, especially their deep, buried subconscious ideas, affect their own health and healing? And what you'll learn is how to discover those ideas and then what treatment approaches will most benefit the patients so they and you both achieve the outcomes you desire.
Steve, which one or two typical problems does the seminar address that many therapists, coaches know from their daily work?
Well, because we have people from so many different disciplines in caregiving, each of those people sees something commonly that others perhaps don't. But what you could ask, regardless of what you see most commonly, whether you're an oncologist seeing a cancer patient or a psychotherapist seeing depression, is either why today, if it's an acute presenting illness, why today instead of a week ago, a month ago, or 2 years from now? Or if you're treating something chronic, why still? Why does it persist? And so the first thing we explore, regardless what you're seeing in your private practice, is how do you discover the causal factors that brought that problem to light today? And this, it turns out, this is essential because learning to treat those factors, that's the gateway to sustained health and healing.
The advanced seminar. Who is the advanced seminar for and who is it not for?
The advanced seminar is for students who have already taken the basic introductory seminar and understand hypnotic method, permissive language, a basic idea about contributory noetic causes to illness. The advanced seminar is for the people who then want to take it to the next step and explore deep into the psyche of their patients, clients, whoever presents with distress of one form or another, how to plumb the causes of their distress and offer ideas that can effectively assist in health and healing. Who it's not for. It's not for the incurious. It's not for the people who don't wonder about what's missing in the discipline they've learned, whether it's body work, energetics, allopathic medicine, psychotherapy of various schools. It's not for those who feel content that they know enough and they can get by. It's for those of us who realize there's more. And what I'm offering is at least some of that more and practical ways to apply those understandings.
What can students do differently or better in their work after the seminar in practical terms?
In practical terms, when you understand the contributory noetic causes of an illness, whether it's a psychological illness or a physical illness, when you understand those causes, you can treat those causes. Most of us, regardless of what disciplines we were trained in, were not trained to treat the noetic causes of illness. Now, I know there are many psychotherapists out there who will say, oh, but I was trained in that. Ideal and ideal. Well, to them, I would say the ideas I offer in this advanced course are very different in terms of what you've learned causes depression, anxiety, OCD, all kinds of psychological maladies. I'm teaching a very, very different approach. And I can tell you from 40 years of experience, it works. I see many, many patients with physical and mental ailments who have tried everything, so they say, and yet who get better using the techniques I'm teaching in the advanced course.
What are the benefits for already successful therapists?
Well, we all can become more successful, can't we? I think people who find themselves or call themselves or consider themselves successful therapists are doing what they've been taught, largely speaking, in their various professional training. What I'm offering in the advanced course is a wider view of what causes human suffering, and then a generous toolbox, unlike any you've learned in your traditional training, how to treat those causes. And so this is a very, very different approach to health and healing. And it's one that I can tell you from 40 years experience and from the reports of my various students and other books and publications. It's one that works. And so if you consider yourself successful now, I can guarantee you, you will broaden the range of problems you can approach, and you'll experience much more sustained and lasting improvements and cures than you're accustomed to.
We get the question, how do the patients benefit from this, from attending the start over? How
Yes.
do the patients benefit? The patients of students that have attended the advanced seminar.
The patients get well. It's that simple. But by wellness, I mean not just a single presenting complaint. Somebody comes in with a dermatologic symptom. Well, you know, a dermatologist can treat that. But generally speaking, they can't prevent other symptoms from arising from the same root cause down the road. Students who go to this advanced course will learn how to treat root causes and therefore not only treat the presenting problem, but also prevent problems down the road.
What is unique about your approach?
What's unique about my approach is including noetic causes, mental causes, in our causal paradigm, and then learning how to discover those causes and treat those causes. I should say nothing in the standard allopathic paradigm is thrown out, but we all know in some way or other that paradigm is incomplete. What we do in this advanced seminar is we don't throw the baby out with the bathwater, but we expand the sea and we learn to navigate that sea and to plummet to discover causes, as I said, and then to address those causes with real expertise so that our patients end up getting what they really want. Many are afraid to ask for it, but what they really want, which is sustained health and happiness.
Can you give me an example of a technique of an intervention that students learn that is immediately applicable?
Many patients, regardless of their presenting illness, arrive there because, largely unconsciously, they have a wish to retreat into illness. This is probably the most common cause, noetic contributory cause of illness, regardless what the presenting illness is. How do you discover that quickly in a single sentence? You'll learn that in the advanced course. How do you treat that? Well, think for a minute. If this patient presents with what I call a baleful wish, the wish to retreat into illness, to get out of something, this probably is not the first or the last time they're going to entertain that wish. But your treatment will eliminate that noxious habit. And so it's both treatment and prophylaxis against future illness.
In the basic seminar, there is a good relation between theory, practice, demonstration, answering questions. What about the advanced seminar?
In the advanced seminar, we extend the theoretical notions presented in the basic course. And we include the ideas our patients harbor, often unconsciously, that contribute to their unhappiness and illness. It's not enough just to understand that or know how to root out and discover those root causes. We have to know how to treat them. And I offer protocols for many of the most common noetic causes of illness in the course, and we practice those protocols so that we begin to have, as it were, a muscle memory for how to address those causes, which we will inevitably discover in our patients. And so it's a carryover and extension from the basic course. And it's really designed, in my view, to help people get to where they wanted to go when they first enlisted in the healing arts. It helps them to become true healers.
Which mistakes do students avoid after the seminar that would otherwise cost them time, money, energy?
Which mistakes do students avoid after the advanced seminar? It's really easy. How many are treating the true contributory noetic causes that their patients are presenting with versus the simple symptoms, the surface manifestation? The mistake is to allow those root causes to persist, which virtually guarantees illness down the road. And so practitioners of these advanced techniques, they won't make the mistake of ignoring root causes. They'll find a way to go after them quickly and efficiently and to eliminate them. And the benefits, as I've said before, are obviously to the patient. They have a sustained result, and it's a positive result. But I would add the benefits to the practitioner are finally, they have a deep sense of knowing they did it right. And there's a quiet sense of pride and contentment that comes from that.
Yeah. Steve, the seminar in itself is great, has been great, and still you have added, or you're going to add two more things. First thing is using hypnotic phenomena, for instance, hand levitation, clairvoyance, in the treatment of cancer, autoimmunity, and other physical maladies. Can you tell me a little about that?
Yes, I use these techniques frequently, almost daily, I would say, in my office practice. And I haven't taught them in the advanced seminar in the past. It dawned on me this past year as I was able to appreciate, my patients actually taught me this. I was able to appreciate how effective these very simple add-ons to standard noetic practices, how effective they are for patients achieving their goals. And so I've decided to include that in the advanced course, so both the students and, of course, their patients can share those benefits.
And the other very interesting thing is many therapists have patients that present symptoms and come with a diagnosis post-COVID or post-vaccine. And you will teach a segment on post-COVID vaccine integrative treatment of enduring symptoms, congestive heart failure, vertigo, etc. That's very interesting. Many people will want to learn that. Can you tell a little about this subject?
In the last year and a half, I've been compelled by the obvious circumstances of being a primary care practitioner to recognize that spike protein disease and its various manifestations it's not plentiful, it's rampant. And in my community, it's largely misdiagnosed, or better, ignored. And so as I say, I've been compelled to recognize that patients suffering from manifestations of spike protein exposure, whether it's from vaccines or COVID itself, require treatment. And so what I'm offering in the advanced seminar is a paradigm really of true integrative medicine, where the noetic component, of course, is not only included but emphasized. But additionally, I'm going to offer non-prescriptive / supplement care ideas for clearing spike protein. And so that anyone, whether you're an MD or not an MD, can recommend. And I will say this, my results, especially this last year in the approach I'm about to teach, have been absolutely extraordinary. If I may, I had a gentleman present with congestive heart failure. He was told, you'll just have to live with this, there's no cure. And his ejection fraction was 25%. For those of you who don't know, it means his heart pump was failing miserably and he could only get about a quarter of the blood in his heart out at any given pump. So he was suffering tremendously. The approach I'm going to teach had spectacular results with this gentleman and with many other patients of mine. I can tell you now his heart function is normal. His doctors are utterly perplexed, but there have been many other benefits. His stamina has increased, his happiness has increased, his sense of physicality has strengthened. And it struck me this year, this is so important and so widespread that it's something I really need to share in this advanced course, because after all, what's our job? Our job is helping patients get to their goals. And what are their goals? Whether they say it or not, many have been taught not to say it. They want a cure. They want to return to health. They want to be happy. And I can tell you from, unfortunately, a very extensive experience over the last 18 months, really, the protocol that I offer for treating spike protein disease will be very gratifying to you and the most delightful surprise for your patients.
Thank you.
And I gotta say, Norbert, I mean that. I mean, when this guy's heart failure disappeared, I was like, oh my God. You know, of course, I was saying it could happen, but then when it happened, I mean, unbelievable.
I can't wait to see you again in the seminar.
Yeah, we're gonna have some good stories, huh?
Yeah.